So my name's Dr. Pav Dhesi. I'm a private GP at Midland Health. So top tips for having summer healthy skin, and probably healthy skin all year round, are basically making sure that you cleanse it both morning and night with a nice gentle foam cleanser. Or if you've got really oily skin, then you need to use more of a cream-based cleanser. And after cleansing, you should always moisturise. Some people like to use a serum in between before they moisturise, but the key top tip always for summer skin is to make sure you use a nice strong SPF. So SPF 30 or above, and try to pick something that's got high mineral content, as that means that it's less likely to bring you out in spots. Both as a parent and as a GP, one of the key things I teach my kids is to start looking after their skin early. It's part of the routine is to make sure that they wash their faces with a gentle wash for their baby skin. And then also I try to encourage them to apply moisturiser on a daily basis and also be very aware of sunshine so that they put SPF on. We do want children to have vitamin D, and a lot of the vitamin D is from sunshine exposure, but at the same time, you don't want them to be exposed to intense sunlight where they're at risk of developing skin cancers. But essentially, you start very simply. Keep it clean, apply moisturiser, put SPF on. As they get older and they might develop hormonal changes, that might change so that you perhaps may use a slightly different moisturiser that's designed for that particular type of skin, whether it's combination skin or whether it's dry skin. But essentially that changes throughout your life depending on the type of skin you've got at that moment in time. And I suppose as you get closer to the other end of life, when you approach menopause or later on in life, actually your skin is quite dry, and that's mainly down to a drop in your estrogen levels. And again, you need to change your skincare routine to reflect that. So we do a lot of sort of coaching for patients and talking them through the best type of skincare routine to suit their stage in life. So in winter months, it's pretty much the same routine. The only difference is you probably don't need such a high SPF, but you still need to make sure that you cleanse your skin, that you always moisturise. It's the moisturising that sort of protects the barrier of the skin, so that's really important. Because when skin dries out, you're more likely to get skin conditions. So the key thing always in eczema is to apply moisturiser. Keep well moisturised at every opportunity. I tend to encourage people, even with their children, to encourage them to keep their skin moisturised, train them to do it so that that's something that they just do naturally, that they apply moisturiser daily. And it's the same with patients who are a bit older. And if you do get a breakout and actually you get any breaks in your skin or it becomes red, oozy, inflamed, that's time that you really do need to see a doctor, because it may be that you've developed an infection, that you need treatment, perhaps antibiotics. But the key thing is, keep it moisturised. If you've got thickened skin, you may need to see a GP so that we can give you some hydrocortisone steroid cream. I think there's multiple things that sort of involve helping the skin heal. So the key things that tend to affect skin, aside from nutrition, tend to be your level of stress in life. So stress can directly impact how your skin is presenting. So can hormones. So hormones play a huge part in how your skin is presenting, whether you're in teenage years and you've got lots of spikes in hormones, whether you're later on in life, closer to menopause or andropause for men, you get changes in your skin. And at each change in hormone levels, you can get an outbreak of acne, you can develop dry skin, you can get thin skin. So there's lots of hormones that play an interactive part. And one of the key things is to start recognizing changes so that you can come and see somebody and talk about what we need to do to help you improve your skin. If you're having lots of skin problems at the moment, it'd be a great idea for you to come in and book an appointment to see a GP to discuss the best options for your skin.